Hello, my name is Harold Wimmer. I am the president and CEO for the American Lung Association, and I'm really happy to be here with you today on this very important conference. The American Lung Association is the nation's leading organization that works to save lives by improving lung health and preventing lung disease. And when it comes to our health and lives, healthy air is critical, especially during these times. Many Americans may not realize that air pollution can be deadly. It can cause lung cancer, worsen asthma, and even trigger heart attacks and stroke. Air pollution also increases the risk of lung disease, dementia, as well as premature birth or low birth weight in newborns. The good news is that under the Clean Air Act, we have healthier air. Lives have been saved and public health has improved. The American Lung Association is defending the Clean Air Act to ensure that all Americans can have air that is safe and healthy to breathe. The Clean Air Act has provided the U.S. Environmental Protection Agency with the authority and the responsibility to protect and clean up the nation's air since 1970. Thanks to that law and later amendments that strengthened it, people throughout the nation can now breathe cleaner, healthier air. In 2011, EPA estimated that the steps then in place under the Clean Air Act would result in the following nationwide benefits each year as of 2020. Again, these are research-based estimates of the benefits that the nation receives each year, including 230,000 premature deaths prevented, 2.4 million asthma attacks prevented, 120,000 emergency room visits avoided, 5.4 million days missed at school avoided, and 17 million days missed at work avoided. Since 1904, the American Lung Association has worked to ensure that the air we breathe is clean and safe, but our work is not done. The transportation sector, including cars and trucks, remains a major source of air pollution. Since 2000, the number of US motor vehicles has increased by approximately 50 million. Nearly half of Americans continue to live with unhealthy air, with significant disparities in air pollution exposure for communities of color. Up to 45% of the urban population in North America may be within close enough proximity to major roadways to increase immediate negative health outcomes, including causing asthma attacks in children and increasing risk of childhood asthma, impaired lung function, and premature death. That's why today the American Lung Association supports transportation transformation. The key for a healthy future is innovation, and the transportation sector is an important area where we can improve air quality and save lives, especially those communities most impacted and vulnerable to pollution burdens. Today's conference will address how the availability of renewable alternative fuels and advances in automobile technologies plays a critical role in decreasing harmful road emissions. Electric vehicles will be a component of this role that has the potential to contribute greatly to emission reductions. The American Lung Association's 2020 report, The Road to Clean Air, explored the public health and climate change benefits of transitioning passenger vehicles, transit, and school buses delivery vans, and the broad trucking sector away from combustion and toward electric vehicles, coupled with an increasingly renewable energy sector. Nationally, electric vehicle usage could yield up to $72 billion in avoided healthcare costs and $113 billion in avoided climate change impacts by 2050 when compared with a fleet of combustion vehicles. In the Midwestern states alone, by 2050, emission reduction benefits could reach $12 billion in avoided healthcare costs, including $3.2 billion in Illinois and $1.1 billion in Indiana, with 1,000 avoided premature deaths, 16,000 avoided asthma attacks, and more than 68,000 avoided lost workdays. To this end, we continue to look for solutions with partners like the other 90 Clean Cities coalitions and the Chicago Area Clean Cities program. The American Lung Association is especially proud of the projects we're working on with the Clean Cities, including our Midwest Evolve program, which works to promote the environmental and health benefits of electric vehicles in the Midwest. We have hosted hundreds of ride and drive events, workshops, and training days where we have been able to collect unique and valuable concerns and information about public attitudes and the acceptance of electric vehicles. Also, our B20 Club, a partnership between the Illinois Soybean Association and the American Lung Association. The B20 Club recognizes a select group of Illinois-based organizations with strong commitments to run fleets on biodiesel blends of 20% or greater. Since the club's formation in 2015, member fleets have used more than 33.2 million gallons of biodiesel, of B20 biodiesel, providing an estimated $6.8 million in health benefits to local communities due to prevented health impacts and lost workdays. We also work with the US EPA on their clean diesel program, and partnering with the EPA and independent diesel fleet owners to modify legacy vehicles with control technology to reduce diesel emissions. The American Lung Association, through this project, has been able to assist 13 fleets in Illinois and 59 in Indiana. We also work closely with ICANN, the Illinois Clean Air Act Now Coalition, which is comprised of clean energy, health advocacy, and transportation industry stakeholders. Each of these projects and partnerships offer a real clean air choice that everyone can make right now. These actions provide measurable emission reductions to benefit air quality and improve lung health. We have accomplished a lot, but we still have much more work to do together. It gives me hope to see so many stakeholders that have come together again for today's event to learn about ways that we can partner, clean the air, lower emission fuels, and technologies. Together, we've poised to leverage innovation and make the changes we need to ensure a thriving industry while also protecting public health and ensuring healthy air for our children in years to come. Thank you so much.